Hello, my name is Sheila Curran-Carverth. I'm a nurse practitioner and I work in the New England Baptist Hospital pre-admission screening department. All patients scheduled for inpatient procedures at the New England Baptist Hospital are required to have a pre-admission screening appointment. The objective of the pre-screening appointment is to check that you are healthy enough to have your surgery. Your pre-admission screening appointment will be located at New England Baptist Hospital. There is paid parking out front. There is also valet service. Wheelchairs are readily available at the entrance. Please enter through the main entrance of the hospital and then report to patient access. Once you've completed registration, you will be directed to go up to the pre-admission screening department, which is located on Congress 5. When you get to your pre-screening appointment, you're going to be seen by many people. The first person you will see will be the pharmacist, so it is important that you bring all your prescription medications in their original bottles, along with any herbal medications you're taking and any other over-the-counter medications you're taking. We'll be getting an EKG and drawing some blood work. The nurse practitioner will come in, will get a complete health history on you, followed by a physical exam. Also during your pre-screening, you may have to be seen by some specialist. For instance, the most common one is a cardiologist and sometimes a hematologist. The time of your surgery is not determined up until the day before your surgery. All pre-admission screening appointments have to be done within 30 days of your surgical date. Pre-screening appointment is very important, and it can take up to 2 to 5 hours. We look forward to seeing you at your pre-admission screening appointment.
The New England Baptist Hospital will call you the day before your surgery to let you know what time your surgery has been scheduled for. They will call between 12 and 4 p.m., so it's important to have access to your phone during this time. If you happen to live far from Boston, you may want to consider staying a little bit closer the night before your surgery just to be safe. They will typically ask you to come to the hospital 3 hours prior to your scheduled surgery time. Once you arrive at the hospital, you'll be directed to the preoperative holding area. Either Dr. Jawa or I will meet you in the preoperative area so we can discuss any final details about your surgery and answer any questions that may have come up. The surgery itself only takes around 2 hours. However, it will seem a lot longer to your friends and family because there's a lot of time that's built in both before and after the actual operation. There is a nurse liaison that's available that can help update your friends and family regarding your progress throughout the day. After your surgery is done, either Dr. Jawa or I will speak with your family and update them on how everything went. Following your operation, you'll be taken to the post-operative recovery area where you'll typically spend between 2 and 3 hours before you go up to the floor. The vast majority of patients after a shoulder replacement will spend 1 night in the hospital and go home the next day. There is a certain subset of patients that may be able to go home the same day. However, we do those surgeries at our specialty outpatient facility, and either Dr. Jawa or I can have that discussion with you. After your surgery, your arm will be in a sling, which is designed to help protect your shoulder. There are certain activities that you're allowed to do, and in fact encouraged to do after surgery. For instance, we want you to come out of the sling to move your elbow, your wrist, and your hand. Additionally, a lot of waist-level activities, such as typing, eating, writing, are all fine to do. We don't want you lifting anything heavier than a cup of coffee, and we also don't want you rotating your arm away from your body, lifting your arm above the level of your head, or trying to reach behind your back. You'll be given a very detailed set of post-operative instructions that will very clearly tell you what you can and can't do after surgery.
Surgery does hurt, unfortunately, but we do everything we can to decrease the pain. You will be getting something called a nerve block around the time of surgery. It's great because it gets rid of the pain. Unfortunately, it only lasts 12 to 24 hours. But in that 12 to 24 hours, your hand may be numb or you may not be able to move your fingers. As your fingers become less numb and the movement improves, the pain will start ticking up, and you'll have a few hours before it really ticks up when the numbness is gone from your hand. So the key is getting ahead of your pain before it really ticks up in the first 12 to 24 hours. So you'll be doing physical therapy in the hospital, working with our therapists there, and they'll teach you how to do hand, wrist, elbow range of motion, but they really won't be doing any shoulder range of motion. When you see me in the office at 2 weeks, we'll give you a protocol to do physical therapy. But I will be teaching you the exercises. I typically don't send patients to formal physical therapy. I have found that patients do really well doing these simple exercises, and the key is not going too quickly. It's going slow in a very paced fashion. I have noticed that patients do much better if they do it on their own at home. They don't have pain and they ultimately end up with greater range of motion. It's more convenient and in the end it's actually cheaper. For patients who aren't quite getting to where we want them to be, I will send you to therapy, but that's usually later where I think you'll benefit more from it at that point.
You'll be seeing us at 2 weeks, 6 weeks, 3 months, and then over the long run at 1 year, 2 years, and 5 years.
It's important for us to see you over the long term to make sure you're still doing well. If at any point you have any questions or concerns, please don't hesitate to contact us. The staff at the Boston Sports and Shoulder Center are here to make sure your experience is as good as possible. Thank you very much for allowing us to participate in your care.